Ever felt like your head was a balloon about to pop? Or maybe you have a cold that just won't quit. You might be dealing with something called acute sinusitis. Don't worry, it sounds scarier than it is. Today, we're going to break down everything you need to know about this common condition, from what it is to how you can feel better, fast. So, what exactly is acute sinusitis? Think of the spaces inside your nose and head. Those are your sinuses. Normally, they're filled with air, but when they get inflamed and swollen, they can't drain properly. Mucus builds up, and that's when you start feeling miserable. It's basically a stuffy, painful party in your head that you definitely didn't RSVP to. This usually happens after a cold and typically lasts for a short time, less than 4 weeks. How do you know if you have it? The symptoms are pretty hard to ignore. You'll likely have thick, yellow or greenish mucus draining from your nose or down the back of your throat. This is that lovely postnasal drip we all hate. Your nose will feel blocked, making it tough to breathe through. And then there's the pain. You might feel tenderness and pressure around your eyes, cheeks, nose, or forehead. This pain can get worse when you bend over. Other fun symptoms can include a reduced sense of smell and taste, a cough that might get worse at night, ear pressure, headache, and even bad breath. Some people also feel tired and might run a low-grade fever. It's like a cold that decided to level up and bring its much more annoying friends along for the ride. Most of the time, acute sinusitis gets better on its own. But there are times when you should definitely see a doctor. If your symptoms are severe, like a really bad headache or a high fever over 103 degrees Fahrenheit, it's time to call. Also, if you've had symptoms for more than 10 days without any improvement, or if you feel better and then suddenly get worse, that's another sign to get checked out. Any changes in your vision, like double vision or trouble seeing, or swelling and redness around your eyes, are also red flags that need immediate medical attention. Remember, it's always better to be safe than sorry. So what causes this sinus misery? The most common culprit is the common cold virus. That's right. The same virus that gives you a runny nose and a sore throat can set the stage for sinusitis. When you have a cold, the lining of your sinuses gets inflamed, which blocks mucus from draining. This creates the perfect environment for germs to grow. While viruses are the main cause, sometimes bacteria can join the party. A bacterial infection can develop after a viral infection has been hanging around for a while, making your symptoms even worse. Less commonly, fungal infections can cause sinusitis, but this is usually in people with weakened immune systems. Things like allergies, nasal polyps, which are small growths in the lining of the nose, or a deviated septum, where the wall between your nostrils is off-center, can also make you more prone to sinus infections. Now, let's talk about complications. While rare, they can be serious. If an infection spreads, it can lead to problems like chronic sinusitis, where the inflammation lasts for 12 weeks or more. A more serious but very rare complication is meningitis, which is an infection of the membranes and fluid surrounding your brain and spinal cord. The infection can also spread to the skin and bones around the sinuses or even cause problems with your vision. This is why it is so important to see a doctor if your symptoms are severe or do not improve. Are some people more likely to get sinusitis than others? Yes, there are several risk factors. If you have hay fever or another allergic condition that affects your sinuses, you're at a higher risk. Any condition that can block your nasal passages, like nasal polyps, a deviated septum, or even facial injuries, can increase your chances. Having a weakened immune system from illnesses or medications also makes you more susceptible. Regular exposure to pollutants like cigarette smoke can irritate and inflame your sinuses too. And fun fact, even changes in air pressure, like when you're flying or scuba diving, can be a trigger for some people. So you go to the doctor. How will they know for sure it's sinusitis? Usually, your doctor can diagnose it just by talking to you about your symptoms and doing a physical exam. They'll feel for tenderness in your nose and face and look inside your nose. The color of your nasal discharge isn't a surefire way to tell if it's viral or bacterial, but it's one clue. In most cases, you won't need any special tests. However, if your sinusitis keeps coming back or is very severe, your doctor might want to take a closer look. They might use a nasal endoscope, which is a thin, flexible tube with a fiber optic light, to see inside your sinuses. In some cases, they might recommend imaging tests like a CT scan to get a detailed view of your sinuses and nasal area. Allergy testing might also be done if they suspect allergies are the root cause. All right, let's get to the good part. Treatment. The goal is to relieve your symptoms and clear the infection. For viral sinusitis, which is the most common type, antibiotics won't help. The infection will usually clear up on its own. Your doctor will likely recommend supportive care. This includes things like saline nasal spray, which you can spray into your nose several times a day to rinse your nasal passages. Nasal corticosteroids, which are sprays like fluticasone or mometasone, can help prevent and treat inflammation. Decongestants are also an option, but use them with care. Over-the-counter decongestants can offer short-term relief, but using them for more than a few days can actually make your congestion worse. For pain relief, you can take over-the-counter pain relievers like acetaminophen or ibuprofen. If your doctor thinks you have a bacterial infection, they might prescribe antibiotics. It's really important to take the full course of antibiotics, even if you start feeling better, to make sure the infection is completely gone. What about alternative medicine? Some people find relief with certain approaches, but the science behind them is often limited. For example, some studies suggest that specific herbal products containing primrose and verbena might provide some symptom relief. However, you should always talk to your doctor before trying any herbal or dietary supplement, as they can have side effects and interact with other medications. Finally, let's talk about lifestyle and home remedies that can make a huge difference. First, get plenty of rest. This helps your body fight the infection and speed up recovery. Drink lots of fluids like water or juice. This will help thin your mucus and promote drainage. Avoid drinks with caffeine or alcohol as they can be dehydrating. Moisturize your sinuses. You can do this by draping a towel over your head and breathing in the steam from a bowl of hot water. Be careful not to burn yourself. A warm, wet towel on your face can also help ease the pressure. Another great tool is a humidifier or a cool mist vaporizer in your room to add moisture to the air. Rinsing your nasal passages is a game changer for many people. Using a specially designed squeeze bottle or a neti pot can help clear your sinuses. Make sure you use distilled, sterile, or previously boiled and cooled water to make the saline solution. Tap water can contain low levels of organisms that could cause a serious infection. And lastly, prop your head up when you sleep. This will help your sinuses drain and reduce congestion, so you can get a more comfortable night's rest. Dealing with acute sinusitis is no fun, but with the right care and remedies, you can get through it. Remember to listen to your body, and don't hesitate to reach out to a healthcare professional if you're concerned. Your health is the most important thing. If you found this video helpful, give it a thumbs up and subscribe for more health and wellness tips. Thanks for watching, and take care.